Cleansing bed bath. Cleansing bed bath is a bath given to weak and bedridden patients. Procedure. Discuss the procedure with the client and assess the client's ability to assist in bathing as well as personal hygiene preferences. This promotes reassurance and provides knowledge about the procedure. Dialogue also encourages client participation and allows for individualized nursing care. Bring the necessary equipment to the bedside stand or overbed table. This conserves time and energy. Arranging items near makes it convenient and helps prevent stretching and twitching the nerve muscles. Close the curtain around the bed and close the door if possible. This ensures the client's privacy and lessens the possibility of lost body heat during the bath. Offer the bedpan or urinal. Voiding or defecating before a bath lessens the likelihood that a bath will be interrupted since the warm bath water may stimulate the urge to void. Wash your hands and wear gloves. This deters the spread of microorganisms. Raise the bed to working height. Having the bed in a high position prevents strain on the nurse back. Lower the side rail near you and assist the client to the side of the bed where you will work. Have the client lay on his back. Having the client positioned near the nurse and lowering the side rail help prevent unnecessary stretching and twitching of muscles on the part of the nurse. Loosen top covers and place the bath blanket over the client and instruct the client to hold the bath blanket in place. If linen is to be reused, fold it over a chair. Place the soiled linen in a laundry bag. The client should not be exposed unnecessarily so that warmth may be maintained. If a bath blanket is not available, the top sheet may be used in its sheet. Remove the client's gown, keeping the bath blanket in place. Removing the clothing provides access during the bath. Covering with a bath blanket maintains the warmth of the client. If the client has an intravenous line, remove the gown from the other arm first. Lower the IV container and pass the gown over the tubing and container. IV fluids must be maintained at the prescribed rate. Raise the side rail. Fill the basin with a comfortably warm water. Change the water as necessary throughout the bath. Then lower the side rail closer to you when you return to the bedside to begin the bath. Warm water is comfortable and relaxing for the client. It is also stimulates circulation and provides for more effective cleansing. Side rails maintain client safety. Lay a towel across the client's chest and on top of the bath blanket. A towel prevents chilling and keeps the blanket dry. Soak the washcloth and fold the washcloth like meat. Having loose ends on the washcloth drag across the client's skin is uncomfortable. Loose ends cool quickly and will feel cold to the patient. With wet washcloth, wipe the further eye from the inner to the outer part. Turn the cloth before washing the other eye. Rinsing or turning the cloth prevents spread of organisms from one eye to the other. Rinse the washcloth and bath the client's face, neck, and ears, and then pat dry. Avoid soap on the face if the client prefers. Soap can be drying and may be avoided as a matter of personal preference. Expose the client's forearm and place a towel lengthwise under it. Using firm, long strokes, soap, rinse, and dry arm and axilla. Strokes should be from the distal to proximal areas. The towel helps the bed dry. Washing the far side first eliminates contaminating a clean area once it is washed. Gentle friction stimulates circulation and helps remove dirt, oil, and organisms. Firm strokes from distal to proximal areas increase venous blood return. Bring a folded towel on the bed next to the client's hand and put the hand in the basin. Soap, rinse, and dry the hand. Placing the hand in the basin of the water is comfortable and relaxing for the client. It allows for a thorough washing of the hand and between the fingers, as well as facilitating removal of debris from under nails. Do the steps 18 and 17 to the near arm. Spread the towel across the client's chest. Lower the bath blanket to the chest area. Soap, rinse, and dry the chest. Keep the chest covered with a towel between the washing and rinsing. Pay specific attention to the skin folds under the male client's breast and female client's breast. Spreading the towel across the client's chest will avoid unnecessary exposure and chilling. Dirt usually accumulates in between skin folds. Lower the bath blanket to cover the perineal area. Place the towel over the client's chest. Keeping the bath blanket and towel in place, avoid exposure and chilling. Soak, rinse and dry the client's abdomen. Carefully inspect and cleanse the umbilical area and any abdominal folds or creases. Skin fold areas may be source of odor and skin breakdown if not cleaned and dried properly. Return the bath blanket to the original position and expose the client's far leg. Using firm, long strokes, soak, rinse and dry the leg from ankle to the knee and knee to the thigh to groin. Pay particular attention to the back of the knee and the groin. The towel and the linen prevents the client from feeling uncomfortable from a damp or wet bed. Dirt usually accumulates in these areas. Fold the towel in half near the foot part and place the basin on the towel. Place the foot in the basin while supporting the ankle and heel with your hand and the leg with your arm. Soak, rinse and dry the foot, paying particular attention to the areas between the toes. Change to the water. Supporting foot and leg helps reduce strain and discomfort to the client. Placing the foot in a basin of water is comfortable and relaxing. It also allows for a thorough cleaning of the foot, particularly in areas in between the toes and under toenails. Do steps 23 and 24 to the other leg and foot. Discard the washcloth and the towel. Assist the client to a prone or lying position. Position the bath blanket and towel so as to expose only the client's back and buttocks. The bath blanket maintains warmth and privacy. Clean, warm water prevents chilling and maintains the client's comfort. Soap, rinse and dry the client's back and the buttock areas. Pay particular attention to the cleansing between the gluteal folds and observe for redness or other indication of skin breakdown in the sacral area. Fecal materials near the anus can be a source of microorganism. Prolonged pressure on the sacral area or other bony prominences may compromise circulation and lead to the development of the cubitus ulcer. If not contraindicated, give the client a rub. Then assist the client to lie on his back comfortably with the towel lined along the side of the client. A back rub improves circulation to the tissues and aids in relaxation. The towel along the side catches the excess powder or lotion to protect the client from skin irritation. Refill the basin with clean water. The washcloth, towel, and water are contaminated after washing the gluteal area. Changing to clean supplies decrease the spread of organisms. Lay a towel under the buttocks and clean the perineal area. If client prefers to do it himself, make a mitt on his hand. Providing perineal self-care may decrease the embarrassment of the client. Effective perineal care reduces odor and decreases the chance of infection through contamination. Help the client to a client gown before attending to his or her grooming needs. A clean gown promotes the warmth and comfort of the client. If with IVF, reinsert the arm with IVF first and check the drip rate. This facilitates ease in dressing. Protect the pillow with towel and groom the client's hair. Hair is lost during the process of combing. The towel collects loose hair. Assist the client to clean and trim fingernails or toenails if necessary. After a bath, nails are soft, thus making it easy to trim or clean. Remove all the equipment used, including soiled linen, and bring them to the utility room. Wash the used equipment and return to its proper place. This makes the room or unit clean and tidy. Doing the aftercare of the equipment used The responsibility of a nurse or student nurse. Remove gloves and wash your hands. Hand washing deters the spread of microorganisms. Record any significant observations shared to attending physician and nurse in charge. A careful record is important for planning and individualizing the client's care.